So you'll see a little red flashing light showing that this is being recorded. So thank you all for being here. Um, I'm excited. This is something we've been waiting for nearly a year. We've been talking about this since really January, when we noticed things were happening in Wuhan. And what is interesting is that in 1918, these same conversations were happening regarding masking. And in March of 2020, I was trying to be creative. I had very little supplies, but I knew we needed to protect ourselves. That's what had all witnessed from what happened in New York, what was happening in Italy, and we didn't have enough. So I had ordered this Amazon face shield and used the few old N95s that I had. And I'm grateful for one of my patient colleagues who gave me a box of N95s that got me through 4 months of being able to do these swabs for all of you until the state could give us PPE. It was the PPE shortage that drove a lot of our inability to take care of people face to face. By June, we had PPE, not an abundant supply. This is me with the head of the CalMap program at in Imperial County. And now we have vaccine, and the purpose of this conversation today is to discuss how to prevent this final aspect of COVID. I just wanted to show you how far we've come along in this whole process of COVID. As in terms of therapy, from a month ago or a year ago, we did not have any tools in our toolbox, as we were helpless just providing supportive care through the phases of COVID. The symptoms are usually very mild. Most people have said, oh, it just feels like I have a allergy, maybe a little fever, or a cough. But as the symptoms progress in a certain group of people, whether it's dose dependent viral load, how much time you spent with another person with COVID, you can have a robust inflammatory response and then end up in the ICU. My job from the get-go in anything I do for all my patients is to reduce severity of any illness so that you don't end up in the ICU. Here are some of the clinical signs, and here are some of the tools in our toolbox that we use in the hospital. And this is something that folks aren't talking about enough, is the monoclonal antibodies. Many of you on the call have received this. If you're high risk, age over 55 with even high blood pressure, or age over 65 period, there are some of the monoclonal antibodies. If we can give it to you early enough, before clinical symptoms or even with a runny nose, we can prevent a lot of this. So I want to educate all of you. If you have a sniffle, like I said from the beginning, let me know so we can address it, so we prevent this part. But today's conversation will be even before this. It's now about the vaccine that we have to offer. There are a variety of different vaccines that exist. We have nucleic acid vaccines, which were considered novel, but they're really not that novel. They've been used for the Ebola epidemic. And everybody's heard about the Moderna and Pfizer. There's more in development. Inovio, we mentioned at one of our first lectures, because we were keeping an eye on that. It's a San Diego company. And these are called RNA viruses, or vaccines, where we administer a little signal, and we'll talk a little bit more. It incorporates in our DNA, and then we create antibodies. There are viral vector vaccines. Shingles is a common one, where we use part of the virus and or another virus, and then it tells um, our body to fight that. It's kind of paired, it's like the coronavirus is paired with another virus so that we can get immunity. Inactivated vaccines use a killed version of the virus, and there are some in development um, for SARS-CoV-2, which is the coronavirus that's currently circulating. And then recombinant viral proteins are things that can be used in vaccine and can be safely given to immunocompromised patients so that they don't so that they have a robust response and then they don't have a viral infection. Hep B, HPV, whooping cough vaccine, zoster, those all are in that category. So talking about vaccine implementation, I'm sure you have been watching the news and how tough and slow this whole process has been. I've been, going to these webinars and seminars and whenever I possibly can and watching this process unfold. I have to tell you, the CDC, the FDA, have been holding these conference calls and inviting all of us into them um, in full transparency. They aren't keeping anything from you. They've been having these conversations about how to prioritize folks, how to get it out, how to distribute it, how to give it to people. And they're, because it's under what's called an emergency use authorization, they want to make sure that it's still going to be, they can evaluate safety, effectiveness, uptake, how many people are getting the second dose. There's lots. Now I think I'm overwhelmed by the communication and the guidance. And I have to tell you, the regulatory considerations have been significant. I have been fortunate to have received a small supply this week. And because of and it's the Moderna vaccine. And because of that constrained supply, they've distributed it to groups of providers in certain tiers, and I'll talk about that in a little while. They're because of that limited dose availability, they're trying to get healthcare providers. Especially right now as we hit our surge, we can't afford to lose critical care doctors and nurses and have them sidelined, because then they can't help save lives and people with high risk conditions. These were the thought processes. Also skilled nursing facilities and adults in congregate settings, because the virus will just rapidly spread through those environments. As large numbers of doses are available, they will expand it to the general population. And as you know, this is just an example. Slide was made before this body called the ACIP had determined the priority group. On December 5th, representatives from the ACIP and the FDA gave a presentation, which I actually have to admit plagiarized. I screenshotted these slides just so I could explain to you what was happening. So they were very transparent that when their meetings were and what their thoughts were in terms of the EUA authorization for the Pfizer vaccine. They were anticipating that meeting on December 10th, and then the second, and what their voting timeline was. And I know it hit the general media. Here is the release on December 3rd from the Advisory Committee on the Immunization Practices for COVID-19 vaccine. And they had determined healthcare settings in general and long-term care settings in particular were high-risk locations for this virus exposure. And they had defined healthcare personnel as paid and unpaid persons serving in healthcare settings who have the potential for direct or indirect exposure to patients or infectious material. And their goals at the time were to decrease death, preserve functioning of society, reduce the extra burden of the disease having on people already facing disparities, and for the prime goal so that everybody can get out there and live a full life. Their recommendations, very simply put, were healthcare personnel. They estimated there were 21 million people who were in this category to receive vaccine. Hospitals, long-term care facilities, outpatient clinics, which I am one, home health care, pharmacies, emergency medical services, public health, as well as skilled nursing facilities, assisted living, and there are 3 million people there. At Sharp, they received the vaccine, and this was their interpretation of that guidance. All affiliated medical staff. I was fortunate to get my vaccine, a Pfizer shot, on Christmas Eve. I know you all know that I was part of the Moderna vaccine trial. I actually had more side effects with the placebo shot that I received. It's amazing what the imagination can do with thinking you want something and you're like, oh gosh, my arm is a little warm. Oh, that little red spot there. It's fascinating the psychosomatic reaction we can have. And I actually experienced that, and I'm totally transparent in that. And I felt nothing with my Pfizer shot. Many of you are volunteers or former volunteers at the hospital and received your first shot. The goal is to get shot into everybody's arm as possible. So it was a little disheartening that my medical staff weren't included, and a lot of doctors in our community were frankly just in tears, literally in tears, because we thought we were in the category to receive vaccine and didn't have access. But fortunately, San Diego County had sent me the 100 doses, and those doses did go to over 30 medical offices and their staff in our region. And so FYI there, but I'll talk more about kind of that, how that happened. So let's talk about the mRNA vaccine. So that is what has been sent out to us. It was discovered in the 90s. It's not as old as it's not as new as we thought. Studied for CMV and Zika. They take advantage of the process that our cells use to make proteins to trigger the immune response. So what it does is the mRNA enters the cells in our muscle. So it's an intramuscular shot. And this signal tells our body to create the spike protein that we've talked about previously, that's on the surface of the coronavirus. And then you've got this little spike protein, it's displayed on the surface of a cell. And then our immune system recognizes that as different and starts making antibodies. Our cell gets rid of the mRNA right after it's finished transmitting that instruction. So it's not incorporated into our DNA. We all have mRNA ACEs, ASE, that will metabolize those any mRNA. It's been fully synthetic. It doesn't contain anything live. That's why they can scale up production and at a fairly low cost. And they've been tested for safety. And despite the rumors, again, it does not alter our DNA since it doesn't enter the cell nucleus. So here's a visual of the messenger RNA. Protein is intramuscularly administered. And then your body will create the spike protein. And then your body will also create antibodies to this. It takes about 7 to 14 days for this process. So just after you get the shot does not mean you are immune. And it takes, the first shot will have you develop about a 50 to 70% immunity, and it takes the second shot to boost it to 95. And that is our current understanding of as of today. In terms of the systemic symptoms or side effects that were published in the phase 1 and 2 trials, and we're getting more and more data and more real world experience from this. Um, in the first, after the first doses, about 30 to 40 percent of people had fever, headaches, and maybe muscle aches. I have to admit, I'm one of the 186 people in the placebo group who skewed the data. In the Pfizer, it's reported to be a little bit higher with some reactions. In the first 50% mild reactions of headaches. I can tell you I've had zero reaction. Some colleagues of mine are feeling a little sore after their second shot of the Pfizer vaccine. With any vaccine rollout, this is the CDC's new Be Safe vaccine health checker. When we give out the vaccine, we're going to give you ways to sign up with your phone or an app so that you can complete surveys for any side effects. And they will actively follow up with you because they're interested in tracking these vaccines that have been released for emergency use. I worked hard watching how I could sign up to receive vaccine as they were creating the rules for me to do so. The goals of states, nobody wants to hold on to vaccine. Everybody's goal is to get it into arms. How to do that is a challenge because a lot of systems have changed and there's a lot of regulatory hurdles and there's tons of paperwork and reporting. And then they want to train us in how to give vaccine. And for me, that feels like an easy thing compared to, taking care of people in the hospitals. But I'm glad they're doing that because they want to train up volunteer providers and folks who aren't used to always giving vaccine. So there's lots of toolkits and materials on the CDC website. But I had to go through some of that and check those boxes in order to enroll for vaccine. And so here's how it comes through to our county. The CDC has allocated based on the number of COVID cases in our state. They proportionally distribute vaccine. And then the California Department of Public Health announced the enrollment, and the minute they announced it, I signed up to receive it, bought a freezer, bought the thermometer, got all of this logistics in place, and then they determined the vaccine to the counties, and then the county, they've got their supply of vaccine, about 120,000 doses, I think, and then they've got some supply, and then there's this ordering mechanism. So they don't really actually deliver the vaccine to me. They send an approval to McKesson, which is the designated supplier from the CDC, who then ships it to the office. So there's just so many different logistical pieces, and it has to be delivered in this thermo-regulated, tracked, microchipped box that then has to be deactivated and submitted back. So there's just this is the last mile, so to speak, that we're talking about between how it's delivered to me and how it gets into your arm. What vaccine will you receive as soon as I can give it to you is the Moderna vaccine. And this, I can't tell you, brought tears to all of our eyes this week because we were able to administer it to frontline staff um, who have been swabbing people for COVID and taking care of people, taking care of wounds, and just doing everything possible to take care of everyone. So, what have been the common reactions? They say now about 80 to 90% of people will have something, maybe a sore arm, mild aches, possible fever, possible fatigue. It resolves in 1 to 3 days on the after the second dose, which now has been expanded that we have this like 4-day window we can give the second dose in. There may be some swelling under the arm in the lymph nodes, more fatigue, some more muscle aches, definite. A lot of people are experiencing a low grade fever. From my experience this week, out of the 100 administered, only 2 people have reported a little bit of feeling fatigued and feverish. There are some rare side effects that have been reported. Now, this is Dr. Lund uh, vaccinating an infectious disease physician who is currently working at the border, who we did last Monday night. I received vaccine on Monday and called in the troops, text messaged all the offices in Coronado, and all their staff came in, and all of the community, 4 community doctors helped, and we got the job done. We immunized about 50 frontline medical staff that weren't covered by their hospital systems. They weren't part of hospital systems, and they were actively seeing patients. So we're glad we could do that. And that's why you didn't hear from me. That's why my email messages have changed. We had hoped that all those frontline staff had been met within that first tier since December 14th's vaccine rollout, that by now that would have been done so we could get shot into your arms. So once we could get all of this done, then we're permitted to go into the next tiers. Bell's palsy has been reported, but it's interesting that Bell's palsy, which is just a little bit of not a little, if it happens, it feels significant of a nerve, uh, temporary nerve reaction that can cause a little drooping of the face and eye. But it has been reported as similar to the general population in spontaneous occurrence. Anaphylaxis has been reported with this vaccine, and one of my colleagues has reported that he did get some swelling of the lip and face. Also, there's been this swelling of the face in people who have had prior fillers or Botox. If you do anything like that, please stay away from it during this time. Also, if you've a recent vaccination of any other sort may augment some of these risks. So if you don't mind, excuse me real quick. Uh, I've got a little dog that wants a lot of attention. So if any of these, if you've had a recent vaccine or fillers or anything, that would be a relative contraindication to receiving this vaccine. During those sessions, some of the thoughts that were going around is, what about pregnancy? That is not a contraindication to receiving a vaccine. However, we don't have the data yet on the safety. So we do know that there are medical staff out there who are pregnant and they are fearful of receiving this vaccine based on the lack of data. But based on the theory that this is just a little messenger and it doesn't get into the fetus and it only creates this antibody reaction, it's proposed to be safe. What about breastfeeding women? They said they can continue through even if you've got the vaccine. A big and important conversation is, what if you had COVID? Vaccination is recommended regardless of prior infection. We don't test if you have antibodies. We'll just go ahead and give you the vaccine. Interestingly, people who were in the clinical trials would show up to receive, placebo or the real thing. And they didn't even know that they were positive for infection and they got the shots, and they did fine. While vaccine supplies are limited, the thought is, well, maybe we'll just hold off if you've had COVID in the last 90 days, because we know that you've got a little bit of protection. But if you do want the vaccine, you've had COVID, and you are a healthcare worker, we will give it. So it's not like we won't. It's up to that individual. Um, and then we don't know, sorry about this, vaccine dosing schedules, the intervals. Like I said, we just found out that we can go 24 to 28 days. So that is something that we're learning more as we go along. Co-administration with other vaccines, there's no data yet. So that's why we were kind of thinking, do we want too robust antibody responses and side effects? Who should not receive the vaccine? Anybody who's had anaphylaxis after a prior mRNA vaccine. Anybody who's had a significant reaction to polyethylene glycol or immediate hypersensitivity with that. Um, and what we would do is have you evaluated by an allergist immunologist. But I can tell you the allergists are texting me saying, what do we do? And so this is things we're doing kind of on the learning as we go. One of the physicians who had a significant immediate reaction, even though they're saying don't do it, this doctor who's frontline taking care of COVID, going in there said, give me some pre-medications. I'll take that risk. I want to take the second shot. So these types of conversations, and this is the reality of what's happening. In San Diego, there are tiered vaccine risk. This is how the ACIP and the FDA guidance that I showed you early on is how it has been broken down into categories. And right now we're in the phase 1A. And just this week, we received a note from San Diego yesterday, actually, that they've opened up all of phase 1A and are entering into phase 1B. But we have to continue doing phase 1A. Phase 1C, they told me they sent me vaccine because they thought I would be in this phase by now. But as you know, by watching the news, we haven't gotten quite through with phase 1B. So, but we are permitted based on the state of California, and 3 days ago releasing a statement that if you have extra vaccine and it's going to go to waste, you go down to the next tiers. And so we'll talk a little bit more about that. In San Diego, if you look at the phase 1A, they split that into further tiers. And so I think that they meant to tell me on the phone that I was tier 3 of phase 1A, where specialty clinics and other folks can receive the vaccine and then administer it. So this is really kind of confusing about the phases and the tiers. Or so just wanted to let you know, being a Navy gal, I want to follow all the rules. And so this has been my priority this week, is just to get vaccine into the staff. What about you? And this probably is the meat of our discussion today, um, because I think everything happens for a reason. Um, the pictures you see to the right are two people I lost last year. My grandmother, who's 97, from COVID at a time when we had nothing available. And sorry. And I think this experience is going to help me help you, because in that phase, we have, and we're finding that we are most vulnerable, who can't get out, who are at highest risk for mortality in ICUs, are the virus is coming to them from home health providers. And that is the group I'm allowed to immunize right now. So right now I'm due to receive more Moderna vaccine on Monday. And I have been calling all of you who have home health providers to make a list so we can get you all immunized. Interestingly, there's some real life lessons that we did not know, and even it was informative to county, is the Moderna vaccine comes fully ready to give. In that bottle, they put in perhaps, they call it overfill, just to accommodate the hub of a needle to reach the full dose, just that microscopic extra that they need to put in. I've got a needle here that to show you. So this is a larger needle and syringe system. But the needles that they had sent out, they send me a kit with needles and shield and not some alcohol swabs, the vaccine cards. There's some deficiencies, but they're just getting it out the door. I'm not complaining. So I used some of our own needles, and we found that if we use the needles they provide, there may be an extra 1 to 2 doses and syringes because they are thinner and the hub is smaller. But in a standard that we had syringes in our office, one vial only got out 10 shots. And that's because of this little hub here where once we squeeze, there's still some residual liquid left. And those little microscopic amounts, or not micro, they're a little macro, add up to an extra 1 or 2 doses. So now I've ordered more of this needles that they wanted us to have that they didn't send enough of, because any of those extra doses that I receive, I don't know what provider is going to show up or not, or have one of those contraindications, which we had some of. I will have extra vaccine at the end of the day. And these vaccines are very touchy. You can't shake them. You have to just turn them. Their shelf life, once brought to room temperature, is only 6 hours. If it's in the refrigerator, unopened, unpunctured, it can last 28 days, but I'm not planning to keep any vaccine around that long. And then but we have to administer it. I don't want one drop wasted. And I thank the 2 patients who lived across the street when we learned this important lesson, who were on oxygen, got into the office and got shots. And this week, that is what we're doing. I've got an eye on the oxygen dependent, highest risk, people who have had transplants, people over the age of 100, over the age of 90, 80, 70, and I'm working the list down. I know all of the tiers you've seen is age greater than 65 and 75. But I think my life lesson has been that these folks are bringing it to these folks, creating mortality. And if we can get this job done, we'll be able to save a lot of lives. And And so that is the priority that I've got. And in full transparency, if those extra doses exist, and they are going to, you're going to get these rapid phone calls at the end of the day. And if I can schedule you anticipating some of these extra doses, please stand by. And I can, many of you on this call or on this session have received these phone calls, and I am starting to get vaccine into arms of patients who are in the categories we've described. And the reason I'm nervous and I'm following the rules is because on December 30th, the Medical Board of California said, thank you, but we might revoke your license if I don't follow the guidelines. And I have to say that that did add a lot of internal stress. But I just want you to know in all transparency that this is why I can't just break the rules for you. I love all of you equally, and but want to be able to meet everyone's needs. I thank you, or I thank everybody in the community. I thank Sharp for giving me vaccine, for helping me do my job for you. With that, I'd like to take this time to answer any questions you have. So I'll open it up to the floor. So we have one question. The time frame to generate sufficient antibodies to produce an immune response to COVID exposure. I hope I addressed that with the first shot, you will have about a 50 to 80% immune response that of protection. But, and then with the second shot, it's 95%. And we think it's about 7 to 14 days. We don't know enough. We do know that younger people have a more robust response than older people. And we still are awaiting more data on that. It's important to note that the Pfizer vaccine does have some data that if you receive vaccine, you won't transmit it to others, but that's still a fear we have, that I've received vaccine. I'm still going to mask up because it doesn't mean I can't carry the virus and then become kind of like a typhoid Mary and then pass it on to others. So we don't want to do that. You will still see mask recommendations throughout all of this effort, even if you've been immunized. Please don't think you're completely bulletproof. You can still get a little bit of a mild COVID and still have mild symptoms, just like we hear every year. Well, doctor, I got the flu shot. Why do I have flu now? And you'll have mild flu, but the important part is you're not advancing into the intensive care unit. And I think this COVID experience has taught us an analogy with what the flu shot does. It prevents hospitalizations, it prevents intensive care unit admissions. But yeah, you can still get flu symptoms and you can still get the virus, and I can still swab you and identify it. And that's why we give you the Tamiflu. Vaccinating patients with underlying heart disease or diabetes, definitely, I want to do that. Does the size of the patient, height, weight, and dose adjustment, is that necessary? We have no data. Any thoughts on people in the 50 to 65-year-old category? As soon as we can get our most vulnerable immunized, the goal is to get everybody vaccinated. So the thought is if they open up the tier group for 65 and above, and everybody before that is ongoing vaccination, many, I would say 50% of healthcare in that 20 million people group are kind of saying, we want to see what's happening to you folks before I take the vaccine. Well, what that did was opened up vaccine for the next tiers. And so as we roll through all those doses, then if I'm vaccinating in one tier and I have a dose at the end of the day, I'll be calling up the next tier. Another thought, another question is, after vaccination, there appears to be 6 to 14-day window when that virus could be contracted. Absolutely. That is true. And we don't know if the disease severity is modified. But yes, you can still get an infection. And you can still get an infection even after full vaccination. This is just anecdote. I think I mentioned it at the last lecture. A couple of 20-something-year-olds in the Moderna trial, they felt the side effects, of course, because they're younger and they had a more robust response. They got the they thought they had the vaccine. They went to Tijuana and partied it up in the bars early on in this pandemic in the summer. And they did get sick with COVID, but minimal symptoms. So, and then what's the time frame between the first and second shot is 24 to 28 days. I definitely am not immunizing anybody who can't be here for their second shot. So we had one intern medical student who's working in an office locally who had flown in from out of state to do an internship here. And I made her delay her flight by 2 days so that she can get her second shot, because that shot's not going to follow her out of state. And the county has promised me that if I give the first shot, they will give me the second shot for all people immunized. I have been up until 1 a.m. every night reporting immunizations through the San Diego system. Even though the CDC says I have 72 hours, San Diego says you got to report it in 24 hours. And so that every vaccine I give is counted, even those extra shots, so that there's an extra shot available, or so there's immunization for the second shot for those administered. Let's see. What's the current data for women who want to get pregnant? Well, no data, but the thought is it's probably better to get the immunization before you get pregnant. So I would recommend get the shot. And if you get pregnant, that's okay. Children appear to be more susceptible to the virus than previously considered. Yes, they have the disease called MIS-C and are, yes, when will it be available for children? Pfizer has just opened up their trials. So Pfizer had data on age up to down to 16. And those 4 votes that said no voted against the Pfizer vaccine, and a lot of people are like, okay, why did those 4 people vote no? Well, I was on a session where that one of the people who voted no in that room told us her rationale for voting no, and it was because she didn't think that 16, 17-year-olds are of an age where they can legally provide consent on something that they had so little data on. So just know that those were very tricky questions of ethics. Do you put your child as a guinea pig out there on this? But like I said, the doctor who's choosing to get pre-medicated even against these recommendations, remember, these are recommendations, lives are at stake, and these are people trying to make informed decisions. And CDC is sending doses based on the number of cases in the state. Yes, California has had a high level. State friends in states with lower cases already have had their vaccine. Do I know why? Um, yes, well, the supply chain issue, I think the regulatory burdens, you saw what the medical board sent to me. Yes, there's vaccine hesitancy in our recipients, but they actually created a little bit of provider vaccine administration hesitancy. I was like fearful of losing my medical license if I gave it to a patient um, outside of the tier. So I think everybody was so busy trying to follow the rules to a T that the enemy of perfection was delay. And so now we received the memo 3 days ago that said, yeah, if you have an extra dose, give it to people down the tier. And I can't tell you what a heavy sigh of relief that was. But some of you who got it this week, I had to say, you know, mum's the word, I could lose my license, but I don't want to throw this shot away. So I think that's why, but now I think you'll see it open up. On Monday, the county is opening up a pod at Petco Park in partnership with UCSD, where they hope to immunize 5,000 people a day in healthcare so that we can hurry up and get through these tiers. We are the largest state of the United States with 40 million people. Trying to get vaccine through is tough. Also, you have to remember all the people doing the frontline work. And there's vaccine to get out, ventilators to get out, oxygen to get out, bamlanivimab. There's just so much to distribute. But once the distribution chain is opened up to everybody instead of these bottlenecks, I think it'll help. Do you get a document or certificate after getting the vaccine? Yes, you'll get a little CDC vaccine card that they supplied me with the lot number, the date, and the date I want you back in the office. Is the second shot exactly the same dose and strength as the first? Yes. Are you going to prioritize scheduling patients over 65 without pre-existing conditions by date of birth? That's an interesting thought. I don't know about equity. My goal is to get everybody done within the next 1 to 2 weeks. So please don't think that this is going to be into the spring or summer. So if that helps and reassure all of you, I'm just going to call you up and say, let's just get this done. How many do I receive a week? I think Amazon follows a paperclip better than what I know on that. So I appreciate the question. I don't know what I get till I get it and count it. But I want to be able to, so I can't make those promises. If I did know that for certain, I would then be able to schedule appropriately. And that's why some of this seems chaotic. You know me, I'm organized. I don't like being this chaotic. But in this chaos, I've figured out an organization scheme for my office. Now, tonight, in transparency, me and a few other doctors and my staff, Karen and Lupita, we're going to have a Zoom call in anticipation of receiving a few hundred doses on Monday. Keep our fingers crossed. And how can I quickly get it out? I may cancel some of your appointments this week if they're for physicals or some routine stuff in order to get vaccine in arms. I apologize for that. I hope one person doesn't mind sacrificing their physical so that we can take care of 100. These are the triage decisions that I'm grappling with right now. I want to take care of all of you and honor my commitments to you for your appointments, but I don't know how. I guess this is a great forum for me to ask you, how do you all feel about that? You want to give me a thumbs up, a thumbs down? That would be interesting to know. So thumbs up, I see. I'm gonna expose my participants so I can see you all, what's going on. You guys can unmute now. Tell me how you feel. I'm not able to see the thumbs though, I'm sorry. I see somebody with the raised hand. And I see the thumbs up, great. Oh, I see 2 thumbs up on the screen, great. Oh, thank you all, okay, good. You know, it's open and transparent conversations that's gonna get the job done. Do you need to make an appointment to get the vaccine? No. I am going to call you and I want you guys at the 15-minute ready. Last week, I called a 95-year-old and said, can you get here? Because my vaccine was going to expire in 30 minutes. And so they did. They did. And so at the end of the day, if I know I'm going to have an extra shot. So what happened is one of the folks, and this is going to answer one of the other questions, had just had a tetanus shot. A nurse came in and had a tetanus shot last week and had some fillers. So I said, well, these are the risks. And so she opted not. So now I had an extra shot at the very last minute, and you couldn't call another healthcare worker from over the bridge or anyone. So that helped. I see that everybody's ready to get the vaccine. Targeting communities and neighborhoods with high virus case rates should be regardless vaccinated. Yes, equity. I agree with you. Should be vaccinated regardless of tier. So in order to meet, I feel like a little bit like Robin Hood here, but there's a huge group of people taking care of our 90 to 100-year-olds who don't work for agencies, who are driving from San Ysidro, Tijuana, Chula Vista, from our high risk communities to come to Coronado to take care of you all. So by putting them at the top of the list, saying, let's vaccinate those 10 people taking care of a 90-year-old who are driving, taking public transportation, bringing that virus into your homes. Let's get that group done this week. Will be a form of protecting all of you. So, and also meeting that equity. So I hope that's another thumbs up for all of you. And yep, I got a thumbs up there. Yes, okay, great. And thank you for supporting this endeavor. I know it's a personal conversation as well as kind of what I'm saying today may change next week. Everything has been lessons learned. I am honored that I think I am one of the first clinics to have received vaccine in our county. So San Diego County is sending staff who call them to my office. So I've immunized doctors. There's doctors who are like anesthesiologists who go from clinics to clinics to clinics to do their job, but they're not affiliated with the hospital system. I've learned so much about the different forms of providers out there that are off grid. And so they're coming and getting vaccinated. Tomorrow, I'm going to put a couple people on the bubble. I'm going to be immunizing at 10 a.m. to my CalMat colleagues. So there's a doctor driving from San Francisco who is going to be the chief medical officer at the alternate care site in El Centro. And as you all know, I mean, they're helicoptering patients away. They are overwhelmed. They're taking care of patients in auditoriums and in the gymnasium. And so that doctor is going to drive to Coronado, and I have one last vial reserved for those folks who are going into the hot zones and taking care of 30 to 50 COVID patients at a time. And so they're coming to the office tomorrow at 10 a.m. And and you don't know if you're going to get an extra dose until you puncture the vial and then draw up the syringes. So I've got a couple of people on the bubble. I may call you at 10:30. So that is kind of what's happening. Do you vaccinate only home health workers of your patients? No, if there's others, I'm happy to do it. And any helpers, yes. Those are all the questions that I see right now. I look forward to contacting you. I want to get this done within the next couple of weeks. We just got to get vaccine in arms, because I am swabbing folks who are over 90 who are coming down with COVID. We're getting the infusion in. Sharp has been awesome. And they are infusing the monoclonal antibody. So let me know early, we'll get it done. Somebody has their hand raised. If you want to verbally tell me what you've got, I'm happy to answer the question, or if the question's been answered. Did we hear correctly that you anticipate within 1 to 2 weeks? Yes, I'm hoping I can do that. If I get hundreds of doses, that may be hundreds of one extra shot. And if that, but I don't know till I puncture that vial. So I schedule home health providers and everybody, and then I have the B list, and then that's how I will get folks in, because I am permitted to go into that next tier, which you all are in right now, with those extra shots. So let me see if I can unmute all now. No, I ask all to unmute. Okay, great. Sorry about that. Anybody else have questions?
Asha, if we have if we know of a home health provider that is, are you there?
Yes, I'm there. Maybe I unmuted everybody and now I've got feedback.
So if we know of a home health provider that is not a caregiver of your patient, how would should they call you, or do you want us to send you their phone number, or?
Call, email, text, whatever it takes. Uh-oh, I'm sorry about the feedback. I'm gonna mute all, but you guys can unmute yourself.
I appreciate such a.
Uh-oh, Mrs. Oh. Sorry, we got muted. But I think that was a thank you.
Yes, thank you. Thank you. A very good information. I appreciate it.
Well, I wish I had I wish we had a ton of data. But right now, because of the EUA, the frontline health care providers, we are the guinea pigs. Our stories are becoming data.
Well, that's fine. That's a help.
Okay. Anybody else? You guys have been awesome for listening and supporting over this last hour. I want to be able to give you this forum to ask me anything you want. Yes, any home helper to our vulnerable population is included, because they are bringing virus into your homes. So we appreciate, thank you guys. It doesn't look like I have any other questions. So thank you. This has been a great hour. Oh, somebody else.
So we should sit by our phones pretty closely the next couple of weeks?
Do you mind?
No.
I think, no, I think we're in the stay-at-home orders anyway, so I just kind of assumed everybody was available.
Yeah, what else have we got to do?
Exactly.
Here for
I know, I apologize for that huge assumption, but I just figured everybody was at home. And so, and it's the stories I'm hearing, those over 65 and 70 are still having some dedicated time to get into the grocery stores. Now, you need to know how healthy, you may not think you're as healthy, but there's the 90-year-olds who are independent or 95, but they were driving, they've only seen 4 walls for a year. And their questions are after vaccine, can I go to the store now? So just realize that in that 30-year span of this immunization category, what the world looks like to different groups of people. And so I just share that with you. So I appreciate all of you. So thank you guys. I will hopefully get everybody done and more to follow. And I'll email you all, email me, text me, whatever you need to do to let me know who's at home with caregivers or folks who need to be immunized, and let's just get it done. Willing to stand down this week to get shots in arms.
Thank you so much. We appreciate it.
Thank you guys. Take care, and I'm going to end the meeting now.
Thank you.
Thank you.
Thank you.
Thank you.
Take care. Bye, everyone.
Yay,
Stay
thank
safe.
you.
Have a nice day.